Good morning, everyone. I am joining you from a very special place this morning, Brown Fertility, where their mission is to conceive miracles, help families grow, and they have added a new doctor to their team that I'm so excited to introduce you to this morning. This is Dr. Daniel Duffy. Good morning, doctor.
Good morning to you, Carter.
We could probably spend the entire hour talking about your background and your credentials. I've loved getting to know you just a little bit when we got to your office, new office by the way, in Tampa, which makes number 13 for this group. But let's start there with your background a little bit. And I know this is your passion to help families grow, as I mentioned, as well.
Right. Well, I'm new to Brown Fertility, but I've been practicing this for about 25 plus years. To get here, you have to do an OBGYN residency and then do a 3-year fellowship. And then every year you're board certified again, but that allows you to practice reproductive medicine only as a sole practice as opposed to full gynecology or something else like that. I taught residents when I was in the Air Force for 10 years, 11 years. So that was very fun because I got to see them form and become OBGYN specialists in that way. And then when it came time to get out, I came to Jacksonville and then now I'm in Tampa.
So this is exciting to have another location here in Tampa.
Absolutely.
Talk about kind of your experience and what you've been seeing. And again, I didn't want to age you, but what you were bringing to the table and I think to this group. How have you seen, when it comes to fertility, what is it that you specialize in? I know surgery as well, but what are we seeing? Where's kind of the world of fertility at right now?
A large portion of it focuses on IVF or in vitro fertilization. And the success rates have gone up dramatically, as well as the ability to cryopreserve embryos nowadays. So because of that technology improving, you can see success rates of 60, 65% when you're transferring a single embryo. Not all couples will need that. As a matter of fact, the majority will not need that. But some of them need surgical procedures for myomectomies or other treatment. And that all is encompassed in their basic evaluation. They basically get 4 tests when they start. One would be an HSG, which is checking for the tubes, and then blood work to see about ovulatory factor and ovarian function, and then of course the men will do a semen analysis, and then they do a pelvic ultrasound. And that's our basic upfront evaluation. And then from there, we sit back down and make plans for them.
When you say making plans, what are some of the most common things that you're doing that you specialize in as well? And I know you really want to help this team, elevate to the next level.
Well, we specialize in ovulation induction. If a lady's not ovulating regularly or timing for it, we can do also add inseminations to that for them if they want that. If they need to, because they didn't get pregnant after, say, 3 of those cycles, that's when we usually have an IVF talk. Surgery is not always required. It all depends on basically the pelvic ultrasound that tells us what's going on, or the lady's other symptoms going on, say she's having pain or something like that.
When would somebody come in and actually see you? I mean, do you need a referral from your, typical OBGYN?
No. If they are having trouble longer than a year, although I've changed that a little bit, I think anybody that's concerned should come in. If you're concerned and you do the evaluation and it turns out okay, then fine, you can keep trying. But you don't want to defer that just because somebody tells you, it takes 12 months to try. And that's usually an age-related factor. That's the biggest thing we're up against, is really ladies waiting too long.
Yeah. What is the other take-home that you want people to know? I told you before we got started, I had a little bit of a taste of this. I have 3 kids now. I know the pain and the struggles that can come with this. But what do you want people to know? And again, the success rate and what your team is doing here and the fact that it's growing, I think is very good news.
Right. I prefer significantly that they get started with us as soon as possible, because I tell them the take home is I can't really tell you what treatment's going to work, but I can tell you that it probably will work along the way. That's why we have a set schedule of 3 cycles here, then you talk about something, so we don't keep on going with unending treatment. We make it a plan for them.
You mentioned you were in the military. That's why I'd imagine it sounds like they've loved the military for long before you even started here. There's a military discount, right?
Yes,
as well.
There is. And they'll get a personalized financial manager helping them go through this as they check for their insurance coverage and everything else.
Well, as you mentioned, time is of the essence. So I think if somebody is kind of interested in finding out more, they really should come in. And I mean, it's only $100 from what I understand to get that first consultation, correct?
Right. And almost I rarely see the insurance not cover their evaluation. It's when
Okay.
they get onto the treatment phase, but that's the other take home. I say get the evaluation done immediately so that you can get onto the treatment. Because I tell them the treatment phase is what ends up achieving a pregnancy for you. You don't want to keep on testing for a year.
Well, Dr. Duffy, I know the team is very excited to have you on board. Again, very excited to have this be the 13th location right here on MLK Boulevard in Tampa. If you have any more questions, go to their website, which we'll put on the screen, and then certainly go to our website as well. But thank you so much, Doctor, for taking some time with us today.